my name is Dr. Eboni Cornish. I'm a functional medicine doctor here at the Amen Clinic in Reston, Virginia. I serve as a board member for the International Lyme and Associated Diseases Society. And I'm also the functional medicine director here at Amen Clinic of our Eastern Division.
Hi there, my name's Jacquelyn Meinhardt. I'm a nurse practitioner working with the Amen Clinic. My focus is on obviously brain health, right? Brain revolution. I work at Georgetown University. I teach biostatistics in the medical school, and I love looking at data. I love looking at trends, looking at how can we make people better, faster, stronger, how to make their brains function better to improve overall life. I'm so excited to be here with you, Dr. Cornish.
Oh, I'm excited to be with you today and every day in the office setting. So guys, it's spring 2023. It's time to do some spring cleaning. It's never too late. So the topic we're going to be discussing today is one that we both are very passionate about, which is detox, spring cleaning, and you. So I'm going to share a few slides today just to give you kind of an overview, and we're going to tag team and go back and forth so you kind of get a understanding of how can you detox, because people think, right, Jack, that it's starvation detox or water fast detox and things of that nature, but we're just going to give you a background of what actually detoxification means, how is appropriate for all of us, and how we go about doing it.
Absolutely. Detox is a big word, right? So it means lots of different things to lots of different people. So let's bring it home to the Amen way.
All right. So first, this is a very busy picture. And I just thought it was important. We thought it was important to just give you an understanding of how the body works. Okay. So it's basic. This is your liver. This is my liver. This is everyone who has a liver, how it works. And the liver, the gut, and the urine are the major ways our body detox. So if you follow me here, you'll see everything that we get is toxic. I mean, we're breathing toxins right now, right? We probably ate something with toxins 5 minutes ago. Everything is toxic. And so what happens is that when we get exposed to those toxins, they enter our body as big fatty globs of toxins, but you can't throw fat down a drain. And so consider our liver like a drain. So what we want to do is take those big fatty toxins that we get from everything imaginable, and you want to make it into water. So you get out your stool and get out the urine. And some of the things we're going to tell you about are the ways our body naturally detoxes, because we need certain enzymes, we need B vitamins, we need things like glutathione, amino acids. All of those things are what helps those fatty blobs of toxins get on out of our body.
Such a great topic, Dr. Cornish. We have one circulatory system, right? Blood, head to toe, right? All the organs in between. We have a second circulatory system, and that's the hepatic portal circulation. That's the liver, the gallbladder, the pancreas, right? And that's where all those toxins are kept. So like you said, all those amino acids, all those vitamins, you need those in that hepatic portal circulation for your body to do what it does naturally, right? So we need to sometimes give people extra vitamin, more than what they think they're getting just with their food and drink, whatever they're putting in their body. They need extra to help that hepatic portal circulation work more efficiently. So that's how we're here to help.
Definitely. And when also other things of areas of detox, you think of nutritional detoxification, mindfulness, and mental detoxification. Detoxification from infections, from environments, and just overall well-being. So the first area of detoxification is one that's near and dear to my heart, which is that mental detox. Like, how do we clear our brain? How do we clear our mind? And it's as easy as things like yoga or relaxation techniques. Sometimes people just kind of meditate with things like infrared sauna, things that get you sweating, and then you're also at peace. That's a great form of that mental brain detox. Sleeping. When you sleep, your brain detoxes. So making sure you have that regular, good sleeping pattern, you're sleeping at the same time every evening, and you're just keeping overall your peace. That's very important.
Absolutely. I couldn't agree with you more. And one of the first things I know that we do at Amen Clinic is we talk about sleep, right? I say to patients, we need to protect our sleep. We need to advocate for better sleep all the time, especially with a lot of our population, which has anxiety, depression on top of toxins, right? Mold exposures, bacterial, viral infections, different types of constitutional things that happen to them, right? We need to be able to focus on sleep and protect it. And that's one of the things I think you and I do really well in the integrative medicine department is helping people learn how to sleep, supplement, how to help them sleep. If you get them to detox, right, they'll sleep better.
Yeah.
Yeah.
Yes, definitely. And you'll have that refreshed, restorative sleep in the morning. That'll help your hormones work better. It's something called cortisol, which keeps you stressed in that fight or flight. It helps that calm down. And it's just overall going to lead to a better day. Because how many of
Absolutely.
us know that when we sleep and get that deep REM sleep, our next day is brighter and it's better. Another area that we work on quite a bit and we work well is how you detox the gut. All right.
That's a big one.
That's such a big thing for us in our patient population. And sometimes it's not just easy as diet. I'm going to do a fad diet. You really want to make sure you're eating things like cruciferous vegetables and you're drinking 2 liters of water. You're having, or minimally 2 liters of water. You're having regular bowel movements and you're just overall taking care of your gut because it is considered the gut is the gut-brain connection.
Yeah, absolutely. What you put in your mouth is such an important concept, right? Everything that you're eat, whether medication, whether it be supplements, whether it be food, your drink, alcohol, we know alcohol is not good for the body, right? Even one drink, like even a little bit is not good for some people, right? It's just not the greatest thing. And that's one thing that we certainly have lots of obstacles around, right? Because of the food that is around us, right? But focusing on whole vegetables, fruit, whole meat, different types of meat, chicken, fish. If you're a vegetarian, looking at organic foods, things like that, those things that we talk about, like endocrine disruptors, different types of pesticides, different types of, products that they put in the soil and the food to help food grow better, right? All those things come into our body when we ingest food, right? And we need help detoxing from that stuff. We call them endocrine disruptors. It's kind of a big term. Again, there's lots of big terms in this conversation that sometimes we just need to break down a little bit easier for people to understand. And it's not just in our food. It's for women. Think about our cosmetics. Think about the body lotions, the shampoos, right? Things that we think that I know when you and I were growing up, we were like, oh, it's just soap, right? Yeah. It's just makeup, right? But we know now with data that there's some things that just are not good for us.
And one of the best sites that Dr. Amen told me about was Think Dirty app. It's not what you think, guys, but it's really a great way of you going into this app, you enter in your products, the ingredients, and it'll tell you a toxic level because like you said, Dr. Meinhardt, we don't think about things like our lotions, our cosmetics, how our laundry detergents, and all of those things affect us both mentally and increase our toxic burden overall. So some of the things I'll tell my patients as it relates to gut health is one thing I like is 7 days, 7 days to kind of start changing a bad habit. So what I'll have patients do is do a 3. I give them that range. If you do 3 days, I'm proud of you. If you get through the whole week, I'm prouder. And it's just maybe just removing one thing at a time that it won't be good for your brain, right? And adding things in like the vegetables we discussed, like protein sources, like Dr. Meinhardt discussed, and meats and all those vegetables, adding those in, because it's sometimes not just what you restrict, but understanding how to eat. That's important for detox.
Yeah, absolutely. Not just, and one of the things that I take it even almost sometimes a step further with people when they're ready, right? When they're ready to take the information is it's not just what you eat and drink, but it's also the time of day you eat and drink it, right? So there's so many interesting topics here. I mean, we could go down rabbit holes on all of it, but but to keep it all in focus, right? Just how everything we put in our mouth affects the way our liver, our kidneys detox the good stuff to feed our brain and to pee and poop out, right? To get rid of it.
Yeah. I tell patients, if you don't think you want to feed it to your brain, don't feed it to your gut. And luckily,
that's a good one.
Yeah, it is. And it like, Lord, that makes sense. Another analogy I would say, look at all the toxic foods you're eating and look at all the meds and supplements you're taking. So if this goes down, and you'll feel healthier overall, because food really is your best medicine. And luckily at our clinic, we have Cindy, our nutritionist, who's excellent at helping you prepare plans that will get you on this dietary gut detox journey.
Mm-hmm. Yeah, 100% agree. Cindy's great.
Yeah. Another area that's very important as it relates to detoxification is just detoxing from all the bad things out there, right? Because Dr. Meinhardt, I mean, I admire all the work you do and we do at our clinic in environmental toxins and mold and just getting those things out the system.
Yeah, absolutely. So there's so many things around us. And one of the things that I tell patients, especially since COVID, right, we've all been home, right, for quite some time. Certainly the, COVID restrictions have eased up, right? And people are going back to work, going back to school, going back to their regular lives, which has been fantastic, right? It's been a pretty stressful couple of years. But, we talk about, sick building syndrome, right? We talk about mold, water damaged buildings, right? It could be your home, it could be your work, it could be your office. But once you have water intrusion into a space, whether it be your home, work, your office, your school, your church, wherever, an indoor environment, right? You have the potential for moisture and the potential for mold growth. And not just mold, right? It's not just mold anymore. We're actually looking at something called actinomycetes, Corynebacter, different types of gram-positive bacteria that grow in those environments and can just cause a lot of we call it immune reactivity. That's a big word too, right? But your immune system reacts and people think, oh my gosh, why do I have brain fog? Why am I so tired? Why did I come into this room? Right? That happens sometimes, right? You're like, where are my keys? Like, where did I put that? Right? Totally normal stuff. But when we start to see that it becomes very frequent, right? When we start to put those pieces together, right? Oh, my basement flooded with that big storm a couple of weeks ago, and all of a sudden they can't remember things, right? They start to have that brain fog. They start to feel like, wow, I'm not rested when I get out of bed any morning, or I'm really gassy now after I eat a meal. Like I never used to be that way. Now I'm feeling very bloated. I wake up bloated, right? Those are not normal experiences. I don't think that people should assume that that's normal, right? Or it's menopausal, right? Oh, I'm 50. Maybe my hormones are wonky. Yep, maybe they are, but guess what? It may not be that, right? Don't always assume that things are normal, especially after some big events like that to an indoor environment.
Yeah.
Absolutely.
And I always tell patients, we're not just discussing mold that's outdoors, right? Because we're all exposed to mold. And luckily, you and we have a clinical center where we do physical examinations. We can look at patients, listen to lungs, do those comprehensive assessments that you need, and can help us determine how toxic you might be, and also may give some clinical clues as to what is contributing to your current presentation. Because I hear that all the time. Well, it's mold everywhere. And, it's so nice that our doctors here at Amen, we have multiple medical licenses, because we see everyone from all over the world, and we can tell some of those states, hint, hint, out there, who you are moldier and more toxic than others, especially with natural disasters that we've experienced over the years. So I do think that's excellent. And Jackie, can you explain like some of the ways you detox from some of these environmental stressors?
Absolutely. So, and it's also important to know what is the issue, right? So I always like to remind people we have to do some investigation, right? It's not just guessing. There's no guesswork here. You want to know what you're detoxing from. That's always important. So one of the things that we talk about is, they're absolutely right. We're in Northern Virginia, right? In the fall, there's mold. Well, actually, there's mold everywhere outside, right? You can't remediate outside. I always say to patients, right, be careful when you open the windows. It's spring, right? All the pollen comes inside. That's obviously not a good thing. But, there is mold everywhere. However, there are 5 molds that are most dangerous to humans that we know about. I can certainly list them, but there's 5 that I tell we absolutely have to know if these are in your home. If these 5 molds are in there and there's actinomycetes, right, or Corynebacter, we may need to do some cleanup, right, in the home. It's not just your body. It's also maybe your environment, right? Home, work, school, what have you. Once we figure out what the issue is and we start getting people kind of thinking in a different way about their environment, not just, and this is a really big conversation. It doesn't happen just once, right? There's usually a few of these conversations happening. But once we figure out what's going on, it's getting them on something called a binder, right? Something that helps them eliminate whatever that toxin is. That it's called a cytokine, a chemokine, right? The byproduct of the immune system. We want to help the people get those detox from those truly, right? And we can do that daily, right? We can do it orally. You can do it with skin preparations, depending on the age of the patient, right? There's different things that we can do, right? Again, depending on what it is we're detoxing from. The one I usually start with, assuming the patients, their guts are functioning properly, right? They're peeing and pooping normally. And that means pooping every day. I talk a lot about poop, right? We got to be pooping every day.
Poop queens. They have to come out.
That's right. If it's not coming out, right? If you're not pooping it out, it's going to come out somewhere else, right? That toxic load is going to build up. And that's really important to understand. I can't get over let me just take a little aside. I can't get over how many people like don't poop once a day. When you actually start asking them that question, once a week. Wow,
yeah, and
that's a lot of toxic exposure.
Yeah, and it's like, well, that's how the basic way we detox, right? Yeah. Regular bowel movement. We can talk about binders, and we're going to talk about supplements and things that can assist that. But as we said before, that gut-brain axis and making sure you're getting things out the gut, because like she said, they're going to come out somewhere and somehow. And what I always encourage as well is patients to do things like Epsom salt baths, with a little baking soda or infrared sauna. We also at our clinic have hyperbarics, and at low dose hyperbarics that can be excellent ways for you to just kind of help eradicate some of those toxins. I've had patients who've done things like enemas or detox, charcoal detox, things of that nature, just to kind of clear the system, because you're absolutely right. Constipation is unacceptable, right? That's unacceptable in our patient population and in you as well. And so the other area, Dr. Meinhardt, you and I spend a lot of time working on in our patient population is chronic infections. I get that quite a bit because I see a lot of patients. I'm a specialist in vector-borne illness and pediatric autoimmune neuropsychiatric syndrome, parasites, you name it, any infection, any bug, we treat it. And what I have found during my experience is that when patients come to see me, they want to fix that infection. They want to kill it. They don't want to hear anything else. But how do you cure me of Lyme? How do you cure me of Bartonella? How do you cure me of pandas? How do you cure me of all these parasites? Cure it and get me out the door. And I always tell the patients, well, you have to have we need the ability to kill organisms. At the same time, we need to also be able to detoxify some of those, what we call cytokines, that are left behind during that killing process. Mm-hmm. So every patient who starts, and I'm treating them for chronic infections and boosting their immune system, we start on a detoxification journey. We sit down, we discuss goals, with diet. We discuss goals with daily detox routines. May that be the baths we discuss, the dietary, cruciferous vegetables, the water, the sauna. And I make sure they understand that, look, sometimes, depending on what you're treating, you may feel worse before you feel better. And we call that the Herxheimer die-off response. Some people are so toxic, especially as it relates to vector-borne illnesses, Lyme disease and co-infections, and even with parasites and yeast, that when you first start that treatment, it's such a huge die-off of all these bugs and different organisms. And if those areas we discussed earlier, like the gut, and the liver and the pancreas, if they're not working well enough, that whole biliary tree to push those toxins out, they're going to stay inside of you, and they're going to lead to things like the brain fog and the chronic fatigue and chronic pain. And I hear all the time, yeah, I'm having that die-off reaction. No, that's not, the Herxheimer reaction is not a victory. That just means you're toxic. So there are numerous herbals, we can have a whole nother webinar, different herbals you give for detoxifications and agents you can use, but more importantly, simple things, right? Like exercise. Jackie, I know that's one of your big areas, physical activity and the importance of using that for detox.
And it's also really important, another concept, and again, we could go down a rabbit hole of this one because we all have personal stories, right? Is people move too fast sometimes, right? And that's one of the things that I always alert people. Yes, you could do this on your own. No, you don't need to go see us. You don't have to come to us if you don't want to. I said, but if you move too fast, that's what that Herxheimer is. You may be moving too fast and not detoxing enough. Right? Like you need to really, I think when you start looking at herbal protocols, or prescription protocols, you really need to be deliberate on how you do them and how you start and then increase, right? I always tell patients it's always easier to move slow through a protocol than it is to move fast and have to take a couple steps back, right? We can get you moving pretty quickly through protocols, but you got to do it smart, right? And you have to know that patient has open pathways, open detox, right? That they can actually eliminate the byproduct of the immune system, right? Whenever we're killing, we got to get it out of their system. I love Epsom salt baths. I think they're great. There's in the saunas. I love saunas. I want a sauna.
Yeah,
I want a sauna.
Infrared lighting. It's so wonderful.
Yeah.
I mean, you can get saunas anywhere these days, infrared lighting. One patient of mine said her gym had an infrared sauna. I've had patients who've done infrared lighting, red light blankets, or, just turned their entire room into like an infrared kind of oasis, so to speak. And I always think that those are great ways, just making sure, as you said, we're putting it in and we're getting it completely out. And making sure you're sweating. Even if you don't have a sauna, you have feet. You can exercise. We can walk. We can do that 10 to 30 minutes a day as long as it's not wiping you out completely. And that's what I call post-exertional fatigue. Some people are like, I'm going to do this. I'm going to sweat. Dr. Cornish said, go, go, go. And then they need 2 or 3 days to recover from that. It's all about balance and, taking one step at a time, but also that physical activity and exercise can really help get those toxins out as well.
Yeah, absolutely. I call that a push crash. Have you ever heard that? The push crash, you push yourself and then you crash. And I always say it's easier to be slow, because I think that's actually the really interesting part. Is typically when we get them through the protocol, they feel so much better. Yes. Right? That they start moving fast. I'm like, no. That's one of the things that we need to caution you on is that you're not going to just jump up and go run 3 miles and you haven't run in a while, right? Like, Don't do that. You're going to want to, but don't, right? We need to really put the brakes on. Because then all of a sudden your body just can't keep up, right? So your muscles are such a great way of burning toxins, of burning sugar, of burning insulin. Like they're an endocrine organ now, our muscles, right? Like that's like the coolest thing ever, that you can use that muscle to help your body get better. And as you and I age, I'm older than you are, right? It's so important that we have muscle. Muscle is so important for our brain. It's so important for our bodies as we age, for our hormones, for our liver and kidneys to function properly, right? Have you remember that term, what is it, non-alcoholic fatty liver disease, right? One of the best things you can do is move your body, right? To help those issues. And people don't even realize they have non-alcoholic fatty liver disease, but I know we see that quite a bit in our population.
Definitely. And, talking again about going back to what we were saying about stress and aging, stress is one of the ways that your body stops that detox process. It's something called the cortisol steal. It's like you're focusing so much on stressing, and, from those years ago, 20 plus years in school, I remember that, trying to study for board, trying to study for this, and all your body is doing is stress, producing cortisol, and it gives up. It's like, what do you mean detox? I'm not going to focus on that. I'm going to focus on building up your stress hormone, and that's that. So I think making sure you do take time for yourself, have that self-care, have that relaxation. And if you need someone to talk to, we have brilliant psychiatrists here at our clinic that help you kind of reset that part, that endocrine system, that cortisol response, and just that emotional support that we need to even get started on a detox journey and to keep it going, right? Because consistency is always the hardest part. So that's why we said this is springtime. We take away one thing at a time to get started. It's not as overwhelming as you all will think. You can start slow, one thing, even if it's simple as saying, hey, those doctors told me to have regular bowel movements. Those doctors told me to go to bed. Those doctors told me to give it a bath. You can start with the basics, and then maybe those toxin things in your life, try one at a time and do your best. That's all you can do is try and do your best.
And we're here to help, right?
Definitely.
So I love our IVs. Our IVs have been such a good addition to the protocols for the people who are in this area or who want to travel to this area, right? Who see us in person. Those IVs are such a good adjunctive treatment.
Definitely. And, these are at our rest in office. These are some of the IVs and these are all the topics we've discussed. These are some of the IVs that we do offer here in Reston. So this is a good overview of what we provide for those who want to kind of jumpstart the process. We have IVs that can help your immune system, like that high dose B vitamins and vitamin C that can really help us in the, allergy season, because vitamin C helps a lot with allergies, with viruses and colds, because we're all getting exposed, even though it's spring, to everything. I know in my triplets, they're in first grade. In their class, every other day, someone's ill from some springtime summer virus. And when it comes to things like infections, one thing, it's Lyme disease time, it's tick time, and just being careful out there and avoiding infections as much as possible. But if you do get that exposure, we have that ability to boost your immune system. We also offer things like eye injections of B12, to give you that extra energy boost that you might need to start your day. And B12 is great as it relates to liver detox, something called what we call methylation, which is your body's ability to utilize B12 and folic acid to clear those toxins or process those toxins all over your body, but especially in your liver. Glutathione, that's something that is present in our bodies. We use it up, and we don't have an unlimited supply of it. And we use that glutathione to clear. It's like that Pac-Man, goes around, bites those toxins up, and kind of helps you clear them out of the cells. And just sometimes people need that just detox with IV fluids. Some of my patients will say, oh my God, when I stand up, I'm so dizzy. I'm dehydrated all the time. I just can't get that water in me. My blood pressure is too low. I've been diagnosed with things like autonomic dysfunction or POTS. I just need help. And those are some of many of the infusions that we offer here at our Amen Clinic Reston office.
And just to piggyback on that, Dr. Cornish, is, people are going back to the office again, right? Like you said, your triplets, they're in first grade. We've got a lot of working professionals who are going back to the office. I say to them, if you're getting sick, consider getting vitamin C, right? Once a week, once a month. Usually I say once a week for a month, and then you do it monthly, right? Kind of so it's not all the time, right? It's not all the time, but even just, before you get on a flight, if you're getting back into the swing of things of traveling, right? Get your vitamin C, get your Myers. If you have pre-op, pre-surgery, right? Get it about a week before surgery, right? Always clear it with your anesthesiologist first, obviously. But, always kind of think about those things. How can you boost your body's ability to behave the way it's supposed to, right? And those extra vitamins and minerals, the master antioxidant, glutathione. I mean, we all could use a little bit of bump of that. So, yeah.
I can use some right now. And, for those people who we alluded to earlier, starting with treatment for infections and are going through that phase where they're starting treatment for Lyme or for viruses or for yeast or strep throat, chronic strep throat, and they feel really awful, when they're starting, because as we said earlier, those pathways haven't been supported and are open, then things like glutathione and Myers cocktail and IV fluids just help you. I call it like a plunger. You have the faucet, those are the toxins going on nonstop, being released. And then you have a faucet that's kind of backed up. So glutathione and Myers and all of them are like the plunger. It helps clear it so those toxins have a way out of your system. Yeah. And if you're interested in learning more about our services, our detoxification services, our functional medicine services, and our psychiatric services, as well as SPECT scanning, because we do a lot of brain imaging. And one thing to understand is that some of our images, the wonderful psychiatrists here are trained to know patterns associated with toxicity. And that's where we come in. They'll say, hey, this brain might look toxic. Let's get a further workup. So I would invite you to, our contact information is here. You can go to amenclinics.com and go to the Reston, Washington, D.C. area. And if you call our office and mention the webinar, you will get a first-time IV detoxification discount code. You just have to make sure you mention the webinar. And Dr. Meinhardt and I are treating functional medicine patients. Our clinic is doing SPECT scan and psychiatric support, mental wellness, ending the term mental disease. And as we stated earlier, our wonderful nutritionist, and we also have our hyperbaric oxygen ancillary service to help with that process as well.
Yeah. And we just hired a therapist.
Yes.
We just hired a therapist, and a good therapist is always hard to find. As I like to say, especially with, I have an 18 and 19-year-old. So, I always say when you think you don't need therapy is usually when you need it the most. So when you think you're fine, it's so important, right? To be able to talk about our feelings. And that's also a big thing too, with our patients who are chronically ill, chronically ill being defined as anything over 6 months, right? Is, sometimes talking through issues helps you move through treatment protocols a little bit more smoothly, right? Because all that history of trauma, all that history of anxiety, depression, things like that can also, we do need to detoxify from those too. And talking, you and I can do it, right? But we also have therapists to help also. We help each other.
Yeah, we wear many hats with our patients, but, I really do encourage people to take that initial step. We're here to help you. We have a wonderful team here at Amen Clinic. We have those services that we do provide. And so I just am honored to be here today to talk to you about it.
Yeah, I love it. I absolutely love what we do. It's been, it's fun, right? Working with you. I love being able to collaborate with you and with the other Amen Clinic doctors and Dr. Amen. he's such a powerful force. He's so awesome. But, it's so fun to be able to work with patients and see them get better, right? That's kind of what we do. What we do is when people say, oh my gosh, I'm so grateful to have you. And I'm like, something, I'm just as grateful to have you because we know we're helping each other, right? Seeing people succeed and get better is one of the best feelings, right? Knowing what you're doing works. So here's to another couple, couple more years to work.
I know. And, that was a great talk, in just having that person understand and having that ability to feel validated. Those are all things that, we love and enjoy with our job. So we look forward to seeing you soon. Look forward to more webinars from us. I hope this was informative. Send all of your questions to us. We will be here to help. And thank you for your time. And thank you, Dr. Meinhardt, for hanging out.
Hang out with you too. This is fun.
All right. You have a good one, everyone.
Absolutely. Bye, everyone.
Hello, everyone, and welcome. Thank you so much for joining us. I want to really thank Dr. Meinhardt and Dr. Cornish for putting this together and giving us this presentation. I know a lot of you guys have been asking for them to do something, and this is going to be hopefully a series. We'll see what happens. But first, before I even go there, I would love to dive into some questions. I am Damian Cook, and I am the clinic outreach manager for the DC clinic. And I'm going to be reading these questions. Please send these questions as you think of them. There's no question too small. Just participate, take advantage of the opportunity. So the first question is going to be to Dr. Meinhardt. What are the 5 types of mold that are known to be dangerous to humans that you mentioned?
Absolutely. Great question. Thank you. So there's so many different types of mold. Mold is everywhere, right? When we walk outside our home, our work, our school, wherever it is that we spend our time, there's mold everywhere. But when you come inside into an interior environment, there's 5 that we're most concerned about. There's Aspergillus varicolor, Aspergillus penicillitis, Chitonium, Stachybotrys, and Wallemia. And they are found in the interior of a water-damaged environment, and they create a immune response in patients where their immune system gets upregulated. Now, all mold outside, right? When people go outside, they may be allergic, they may have different allergies, right? But again, when we come into the indoor environment, we worry about all molds, but those are the 5 we are most concerned about.
Awesome. Appreciate it. Thank you.
Yeah.
The next question we have, this is for Dr. Cornish. So the question is, where does a patient start with addressing the need to detox? Are the lab tests that can identify the need to detox and the need to seek treatment?
Sure. So when it comes to the need for detox, we all need to detox, because our world is much more toxic now than ever before. So we're all completely toxic individuals. And if it starts as simple as like an Epsom salt bath, one of my really easy recipes for detox and a way to start at home is Epsom salt, a cup of Epsom salt, a half cup of baking soda, a little bit of clay. You can get that at CVS, one of those, what you see maybe for a charcoal face mask. Put a little bit of charcoal or bentonite clay in your bathtub and soak for about 15-20 minutes. Or you can do a foot bath. That's something simple. Other things, just look at your diet and ask yourself, okay, I've spent this time listening to this webinar. What is something that I know my brain will not enjoy me eating? And even if that means just taking one step at a time, one food group. If you say, all right, I'm going to remove processed foods like gluten for a week and see how I feel, or 30 days. I'm going to remove sugar. Just trying your best and not setting unrealistic expectations And I tell my patients that a lot because you'll hear, oh, yeah, I'm going to do a water fast, a juice detox, and this. No, you need to do things that are suitable to your needs because afterwards, you don't want to just go backwards and just like binge eat on everything you removed from your detox plan. So that's just something simple, some simple, easy initial steps that anyone can do. And if you don't like the bathtub, even consider doing a foot bath. Other things, labs. That's great. Asking, because a lot of the labs we use to evaluate for toxicity, we can, the initial round of labs, you can get done at your standard LabCorp and Quest. And it's just about what markers you're looking for. So there are certain markers that can tell you if a body is inflamed. For example, ferritin, that's a good place to look. If your ferritin levels, which your doctor can order, are elevated, that might be a chance to question, give you a reason to question toxicity. Also, things like your C-reactive protein, all right? It's a marker for your heart, but it's also a marker for inflammation. Things like C4A, with the number 4. That's another inflammatory marker. TGF, as in Frank, beta 1. That's another lab, TGF beta 1, that will help you know if you're inflamed or not. And just things like ANA. But also looking at your basics, staying on top of your physical. So screening for diabetes, your glucose, your lipids, because with your metabolic status, if that is abnormal, you can also potentially be toxic, right? So those are just easy ways to get started. It's not too tough. And just inquiring with even any doctor to draw some of those initial markers.
All right, that kind of leads into the next question. So are integrative medicine treatments available then at all Amen Clinic locations?
Yes, they are. So it's wonderful because we have Dr. Meinhardt and myself, we're on the East Coast as functional medicine providers, but we have our licenses in numerous different states around the country. We also have functional medicine providers, naturopaths. We have 4 naturopaths and another functional medicine MD on our West Coast. But the good thing is you can see, because of the state of telemedicine, any of the functional doctors here at the clinic. And when you get evaluations, even outside of functional medicine at Amen Clinic, you can get referred to see a functional doctor anywhere around the country. And most of us have multiple state license here, which makes it nice.
Awesome. Appreciate that. And so the same person's also curious on the benefits of infrared saunas and how long should you have to use it to reach those benefits?
Great question, Damian. I love infrared saunas. I think that they are infrared light therapy. I think it's so fantastic. Red light therapy, when we look at the history of it, right? Photoimmobulation is what the technical term is for. And we know that the red light tends to stimulate something called adenosine triphosphate, or shortened ATP for short, which is basically energy, right? It helps produce ATP, right? It upregulates it. Energy metabolism decreases oxidative stress. Oxidative stress is a really fancy term for basically not good stuff happening in the body. Inflammation, right? That's kind of a big term for inflammation, which also means lots of different things, right? And we also see that photoimmobulation therapy, like red light, can also impact things like the overall inflammation and sleep. So really important and very beneficial for people who have access to it. You can do it in your home. You can purchase or rent a light. You can go to some standalone clinics that also have red light therapy available to them. Interesting enough, red light therapy has been studied in multiple clinical situations to include different psychiatric care to be tested there or to be looked at there, but also different neurodegenerative diseases like Alzheimer's and different type Parkinson's disease, for example. Research is still in its infancy, so we're still trying to figure that out. However, the research is promising, right? It does look good. So it's helping with a wide range of therapy. And the issue is when we talk about light therapy, we're looking at the wavelength. So there's different wavelengths of light. There's red, there's blue, there's white, and it has to do with the wavelength. And red is the one that looks more specifically at what I mentioned before, the ATP production. That has to do with the mitochondria. That's the powerhouse of the cell, right? So when we look at one individual cell, right, it has a mitochondria in it, but we're made of trillions of cells, right? So if we can make one cell healthy, imagine what we can do, right, to the whole body. And there's little lights, and then there's big lights. And then there's lights that you can lay on, right? They have, this one company has something that you can actually lay on where your whole back is covered, your back part of your body from your feet to your head with red light. Some people do them in the morning. Some people do them at night, depending on what the benefit you're looking to get, right? So when and then the volume of the light, like how bright is it? That's also really important, helping with sleep, right? Different types of sleep dysfunctions. I love red light therapy. I think it's a good option for the right patient at the right time in their treatment program, right? And so always communicate with someone who knows a little bit about the therapy or who knows about the therapy, because we certainly don't want, different things happening that may increase, right? We're talking about detox here. We don't want to do too much at one time, right? We want to slowly get into detoxification. So I don't recommend people do red light therapy, their first treatment for an hour, right? There's actually a process for it, I think, that has helped many of my patients. That's typically my experience. I love red light therapy though. It's a good option. And it's not pharmaceutical, right? Which is even better.
Awesome. Appreciate it. The next question we have is, should you see a doctor before seeking IV nutrient therapy?
Yeah, and I just, before we answer that question, Dr. Meinhardt, I just wanted to add a few things to what she said about the sauna. It was the one study out of Finland, which I thought was remarkable, when they showed that using infrared sauna 2 to 3 times a week decreased the risk of dementia by 30%.
Yeah.
I typically, you don't want to just jump in there. You want to stay hydrated. I usually tell my patients start at 20 minutes, but the goal is 3 to 5 times a week, 30 to 60 minutes at a time at 120 degrees Fahrenheit to 140 degrees Fahrenheit, but build up to it and also stay hydrated rather. As it relates to seeing a functional medicine or doctor prior to infusions, at our clinic, you're able to see a functional medicine doctor no matter what. You're able to see us for any of the conditions that we mentioned earlier without having to necessarily have a SPECT scan. You can just say you want to have an initial functional medicine workup. Dr. Meinhardt or myself, if you local, we have local, like I said earlier, examination rooms. We can do physical exams. If you're out of state, we can do telemedicine. I mean, it's as easy as that for any kind of imbalance you may have medically. As it relates to our program, there are screening questions that you fill out prior to having an infusion. And during your infusion, you are monitored by a nurse throughout the whole time. Your vitals are taken before and after, and the physician, either myself or Dr. Meinhardt, will be in the office during your treatment.
Awesome. Thank you. And this is an interesting one. Is fruit juice toxic?
That's a good one. That's a good one.
Yeah. Yes, it is. You might as well just pour sugar, in a cup and drink it. That's the thing. And yeast is created by high sugar. I have so many of my patients who drink juice all the time and they think, oh, I'm so healthy, I'm drinking this fruit juice. And they're not looking at the sugar content in those juices, even if they say 100% juice. And they end up having to worry about bloating or yeast or problems. So yes. What do you think? What do you think, Dr. Meinhardt?
Oh gosh, something, and you and I are both parents, right? So we a lot of these questions I think of not just as a provider, but also as a parent, right? Because that's life, right? The short answer is no, I don't recommend juice. I don't think it's a good idea. However, if you have to use it, dilute it a lot, right? Because you don't want that sugar. Even if it says 100% juice, you think that it's actually healthy for you, I'd much rather you eat an apple, like an apple, versus drink apple juice, or an orange versus drinking orange juice. But I get it, right? Like I get the conundrum of being a parent and having kids, or even wanting, like if you need to take a little bit of juice, right, to get your pills down, dilute it a lot, dilute it a whole lot. Or use electrolytes, right? Use something different that has no sugar to it. Like there's so many different companies now that offer no sugar electrolyte drinks. I'm not a fan of those sugary sports drinks either. If you can find another solution, I think it's always better.
Awesome. Appreciate that. That's really hard for parents as well. I know my daughter, when I introduced her to actual juice, that was the wrong thing to do.
Yeah.
Yeah, her eyes lit up and I was like, oh, that's a lot of sugar. So definitely. So the next question is how to prepare or recover from general anesthesia. How to prepare or recover from general anesthesia.
Lots of water. The number one solution for detoxification, right? The first thing you should always do is increase your water intake, right? Always, because you need to flush out those you need anesthesia, right? Obviously, if you're having a surgical procedure, you're going to need that. So I'm not saying it's not an option, right? But you need to get lots of hydration in there. And then there are some herbal products that I know Dr. Cornish and I have used that in theory help with detoxification there. But that's something always talk about to your medical provider before you do anything like that, obviously, and get clearance, depending on the surgery that you're getting done, obviously. But hydration, always key.
I agree. And also cruciferous vegetables, things that you can eat that can help support your liver and clearing those toxins out the liver, because that's how you're going to be processing that anesthesia. And then using some of the methods we discussed earlier to help you process those easy lifestyle methods, like we discussed, saunas, infusions, infrared light therapy, all those things just to help your body purge.
Awesome. Appreciate that. Okay, so the next question, this person wants to bargain here. So we're back. We're talking about the juice again. All right. So I know so we're not going to let this one go. So I know store-bought juice is high in sugar, but what about squeezing home juicing when it comes to like veggies and fruit?
Oh, of course. Yeah, that's a no-brainer. You should definitely, if you can make home juice, I would love it. I don't think people should refrain from eating fruits and vegetables ever, unless, of course, that's on your dietary restriction or some sort. But yeah, that's a definite option.
I think juicing at home, I think, is a great option. Always go for some of the pulp. The pulp is what has the fiber in it. And that'll help with detoxification, but also other health benefits as well. But yeah, I agree with Dr. Cornish. Home juicing is totally different than like store-bought juice.
Definitely. Gotcha. Okay. Awesome. So hopefully that's settled. And then we have, can you detox if on high blood pressure medicine? How can you detox? I'm sorry. If you're on high blood pressure medicine, how can you detox?
Carefully.
Yeah. I mean, the first thing, keep it simple. Yeah. If you're on high blood pressure medication, well, what's triggering that blood pressure, right? Yeah. And, there can be stressors that can trigger high blood pressure. I mean, we're all stressed. So getting that center, that wellness, that self-care, that mindfulness, that's mental detox. That's resetting that cortisol response. If you want to do things like removing foods that might cause your blood pressure to go up, like the fried foods, the cholesterol-rich foods. If you're eating things that might be a little junky, I mean, we all cheat, right? But if you're doing those things and trying to be cautious because they can trigger high blood pressure. Exercising. Another thing we didn't mention about sauna is that the research shows it's kind of like a cheating way to get some cardiovascular stimulation, right? So even using that infrared sauna to help stimulate cardiovascular activity, getting out there. It's a good season. That's why we did it while things are warmer outside, so you can get out there and walk and sweat on your own. And that'll also help your blood pressure go down. So hopefully we'll be killing two birds with one stone. We'll be decreasing the need for blood pressure medication over time by doing some lifestyle changes in lifestyle detox, methods.
All
What about
right.
you,
All right.
Dr. Meinhardt? Anything you want to add about that?
Yeah, absolutely. So, so my original career, right, was in emergency medicine. So I see lots of different high blood pressure, right? And I always look at high blood pressure as a very potentially complex thing, right? Which I know we all do, right? And I guess the most important thing is, why do you have the high blood pressure? So I 100% agree with lifestyle. I 100% agree with, red light therapy and IV therapy, 100%. But lifestyle becomes so important. It's looking at what's your weight to your height ratio, what's your LDL, what's your insulin resistance. What are all those things that play and make it a bigger picture? Is it a diuretic that you're on, right? Because if you're on a diuretic, that's going to be a whole different conversation about how we detox you, right? Because we don't want your blood pressure to go down too low, right? While we're doing all these wonderful things. So it can become complicated. So those patients, I always say, start off with hydration, start off with looking at a good lifestyle check, right? Like Dr. Cornish said, maybe looking at some processed foods you can get rid of. Like I always say, do one thing a week. Increase your water 1 week. The next week, you're going to take out crackers. The next week, you're going to take out bread. The next week, you're going to take out something else, right? Because making lifestyle changes for some people is really hard. It's not easy. I think we've all had a situation where we can think of something that we tried and we're like, wow, this is a lot harder than I thought it was going to be, right? So being really real and honest, I think, is really important when communicating with patients, that it's okay to have a cheat day, right? That's really important. But again, it's, why are we doing it? Like, why are we doing this? And why are you on those blood pressure medications? That becomes the real issue.
Awesome. Awesome. So it looks like we came to the end of the questions, and we're going to actually start to just wrap everything up. I wanted to thank you guys for taking the time to speak with us today. Really do appreciate it. The one thing I really love about both of you is the fact that when you're with your clients, you really spend quality time with them. And I can tell you definitely genuinely care about them. So I'm sure making those changes are a little easier for them when they're working with you. So it's definitely a privilege, and I appreciate you guys putting this together. I wanted to make an announcement, let everyone know that we are running a promotion. It's actually 10% off of our IV nutrient therapy. So that's actually 10%. What you have to do is enter the code webinar 10. It's a webinar 10. And that offer is going to be good through August. So that's our time. I would like to leave it with you guys if you would like to leave us with any closing remarks.
Sure. I'm proud of all of you guys for listening to this. It shows that you're taking that first step in your healing journey. It's all about trying, right? And this was your first attempt at trying to cleanse yourself, whatever that may mean to you. And I encourage you to continue to do so, but also realize we're not saying that it's going to be overnight, one step at a time. And this was your first step to listen, to even get tips on how to do this. We're here for you. No matter where you live, we're here for you. And we just appreciate the time and hope you left with some new things to implement at home that can be useful for you and your family.
100%. I 100% agree with what Dr. Cornish said. One step at a time. And that's one of the things I know Dr. Cornish and I do really well together is, really looking at that and making sure that people have the support they need, because some of these things aren't easy, right? We get that. We 100% understand that. And we're here for you. So let us know how we can be of service. Thank you.
Thank you.
All right, that's our time. Thanks for joining us.
All right. Thank you all for listening.